Well, hello, everybody. I am Congresswoman Nikema Williams, and I proudly represent Georgia's fighting 5th Congressional District, where we continue, even in these trying times, we continue to fight for equity and justice in our healthcare. So today's reintroduction of the Endometriosis CARE Act marks a renewed fight for funding to support millions of overlooked women, including myself, who suffer from endometriosis. Know that I see you and I feel your pain, and that's why I'm reintroducing the Endometriosis CARE Act. Y'all, every single week I am talking with someone and I hear from another member of Congress, like this morning with Congresswoman Amelia Sykes, who told me that she has endometriosis and she wants to join the caucus and help us push to make sure that we get the funding and research needed for endometriosis research. But I also hear from constituents and I hear from people in my DMs, text messages, inbox, because this is something that so many people are paying more and more attention to, and we have to get this funding across the finish line, but even more importantly, making sure that it's actually enacted once it's passed. This legislation will help ease the burden of endometriosis by investing in the research necessary to make critical advancements in treatment. This comes at a time when the sciences that we trust, the funding that supports them, and the very foundations of our healthcare systems are under attack. I've sat in my office with researchers who were riffed and let go because of this administration's abandonment of science. I've stood with scientists outside the CDC as they told me about the programs in our public health at risk due to the administration's cuts in the name of billionaire bailouts. And earlier this year, the 19th published a piece asking what happens to health research when women is a banned word. Think about that, y'all. In 2025, the word woman or women is a banned word when it comes to research. But I'll tell you, there's a reversal of our progress, our health, and our ability to treat diseases like endometriosis. More women will suffer, more women will continue to be in pain and agony. And I've been here before. Prior to 1993, when the US Congress passed a law requiring the inclusion of women in all clinical research, women were left out of the conversation. It's been an uphill battle and a game of catch up for women's health in the research space. And endometriosis remains one of the many health issues plaguing women that we must fight to bring to light and secure the support needed to address. Y'all, this fight is personal. I've told this story far too many times, but I will continue to share it, hoping that we can get the research and the funding so that no other 14-year-old girl has to experience what I experienced. I've battled excruciating endometriosis pain since I was 14 years old. For far too long, my doctors ignored my pain. One even asked if I was exaggerating, told my mom, well, do you think maybe she just doesn't want to go to school? The pain caused me to miss classes, family events, and even to this day, sometimes it gets in the way of doing the work of the people here in the United States Congress. But after changing doctors to one who would finally listen, I learned the pain had a name: endometriosis. Unfortunately, far too many women never get the answers that they need and deserve, or they have to wait years to get them. Studies show that on average, it takes a woman at least 7 to 10 years to receive a proper diagnosis. And it is estimated that Black women are 50% less likely to be correctly diagnosed with endometriosis and are instead misdiagnosed with pelvic inflammatory disease. The misdiagnoses, the limited treatment options available, and the physical and financial burdens of endometriosis, all of this is the direct impact of ongoing disparities in women's health research. And that's what we aim to change with the Endometriosis CARE Act. The Endometriosis CARE Act would invest $50 million annually for 5 years in endometriosis research through the National Institutes of Health. These research investments are necessary for the innovation needed to create more medical treatment options. Right now, treatment options are still limited and often involve surgery. which is a burden in and of itself. And I know this all too well because I had my first surgery at 14, which was how I was initially diagnosed with endometriosis. The Endometriosis CARE Act will also provide us with a better understanding of the condition, and in particular, the disparities in its prevalence, detection, access to care, and treatment outcomes. The Endometriosis CARE Act will commission a nationwide study that will help us answer the unknowns that still exist around endometriosis. And finally, the Endometriosis CARE Act will help bring light to a disease that is often not even talked about by establishing a national campaign for public awareness. A lack of awareness about endometriosis means that often people living with the disease don't even know the questions that they need to ask. So I am grateful for Congresswoman Lauren Underwood and Congresswoman Alma Adams, my co-leads in this effort. And I thank every scientist, every researcher, and every advocate in this space working to bring awareness to this disease affecting approximately 1 in 10 American women. Today, we renew this fight, and next, y'all, we will win it. Thank you.
Thank you, Congresswoman Williams. I'd like to pass the floor now to Lauren Kornegay with Endo Black.
Hello, everyone. I hope everyone's doing good today and that you all are staying warm. I know that we have some weather coming, so please, please, please stay cozy and bundle up. Of all of the forms of inequality, injustice in healthcare is the most inhumane and the most shocking. Martin Luther King Jr., Montgomery, Alabama, 1965. Greetings again, and I am Lauren Kornegay, and I'm a lived experience expert for endometriosis. I was diagnosed with endometriosis on March 18, 2011, just 3 months after completing my senior year at Morgan State University in Baltimore, Maryland. This was a quick and unexpected start to adulthood for me. In all of these years of navigating endometriosis on a daily, here are 3 things that I have learned. 1, endometriosis is not a one-size-fits-all condition. It is a complex, systematic disorder with multiple layers. 2, health disparities play a huge role in creating barriers to accurately diagnosing Black and Brown women. And lastly, the history of endometriosis care has come a long way. We still have far to go, and we need research to do that. Let me start by grounding things in my personal lived experience. As I mentioned, endometriosis is complex, and this complexity is not new. Back in 1982, researchers Chapman and Ward were able to analyze systemic teenagers and found a 65% prevalence of endometriosis during laparoscopic surgeries. For decades, endometriosis was dismissed as a woman's pain or bad periods or psychological distress. Early medical texts rarely included Black women at all, which contribute to the false belief that we didn't have this disease at all. Those assumptions shape trainings, diagnostic criteria, and research priorities. So when we talk about progress, it's so important to remember we are correcting over 100 years of misunderstanding and underinvestment. As I've mentioned, we have known for decades that endometriosis shows up in many forms, at many ages, and with many presentations, and yet our diagnostic pathways have barely evolved. The way I manage my symptoms and even how those symptoms show up is different from someone else's experiences. On EndoBlack's website, we list the most common symptoms in our endometriosis tracker. But before I get into symptoms, I want to share a little bit more of my story. Back in 2010, I visited an OBGYN office because I had concerns about my menstrual cycle. That visit led to an on-the-spot diagnosis guided by one simple question: how are your periods? Followed by a pelvic exam. A few months later, laparoscopic surgery confirmed that I was diagnosed with endometriosis, but my story didn't stop there. Several months later, after being diagnosed, I found myself lying on the floor, staring up at the ceiling. I completely passed out. I was confused, scared, and alone. I tried getting up to go to the hospital, but my body was just too weak. So, like any 21-year-old, we just slept it off because I thought it was the most appropriate thing to do. Within one day and two more episodes of passing out, I was back in the hospital. I had ruptured a cyst that left 2 gallons of blood in my abdomen. I was mortified. I needed help, I needed a community, and I needed guidance, and I didn't know who to turn to. And in that moment, I realized just how complex and unpredictable endometriosis was. That experience showed me just how unpredictable and overwhelming, as I mentioned, endometriosis could be. And it also showed me that I felt my body in different ways. And it always didn't match with the endometriosis is supposed to look like a specific way. That's why understanding the full spectrum of symptoms is so important for us. We have to think about the beyond the basics. Now, the most common symptoms that we may know of for endometriosis: heavy menstrual periods, bloating, vomiting, nausea, difficulty conceiving, pelvic cramps, and lower back pain. But there are many more possible symptoms. This can include sharp pains in your back, abdomen, breast pain, fatigue, migraines, and brain fog. And for me personally, the symptoms that showed up were knee pain in my left knee before my period and knee pain in my right knee after my period, abdomen pain, sharp pains in my back, and I also struggled with shortness of breath. Now imagine if my doctor had ignored all of those things. A 2022 study in American Journal of OBGYN found that Black women are 50% less likely to be diagnosed with endometriosis, not because we experience it less, but because we are believed less. Imagine they had assumed I was drug seeking because of my skin color, because of my zip code, because of my age, or even because I decide to have locks. Unfortunately, this is the reality for many Black women. Medical bias and racial disparities lead to delayed diagnosis, and when the average diagnosis for endometriosis already takes 7 to 10 years, the added weight of bias is devastating. Earlier this year, I was able to complete and collaborate with George Mason University on our EndoServe study titled Stigma and Discrimination Experienced by Black Women with Endometriosis in Washington, D.C. metropolitan area. This pilot study found that Black women who perceive their providers making assumptions based on racial stereotypes experience significantly higher anticipated stigma. In other words, many Black women expected poor treatment before they even enter the appointment. And that expectation shapes everything from how they report out their symptoms to whether they even seek care in the first place. This is not new. Dr. Donald Chapman, a Black gynecologist in Chicago, conducted a survey years ago showing that 40% of Black private patients with surgically confirmed endometriosis have been misdiagnosed with pelvic inflammatory disease. Even today, Black women continue to be misdiagnosed with either fibroids or other conditions because their pain is either minimized or misattributed. In 2016, the Association of American Medical Colleges reported that half white medical trainees believed that Black people had less nerve endings or thicker skin. When that is what students believe, imagine how it shapes the care of Black women receiving care in those exam rooms. And then there are the structural barriers. We have hospital deserts, zoning issues, limited transportation, and food deserts. We often hear eat healthier as a recommendation, yet for someone with endometriosis, it's not as simple as just eat healthier. These are some of the things that we want to focus on. This talks about the things that I've shared have shown the complexity of the disorder. And when we talk about the treatment disparities, the numbers are stark. Black women receive hysterectomies at a rate 3 times higher than white women, and in some rural Southern hospitals, up to 90% of hysterectomies among Black women occur there. This is not the result of patient preference. It is the result of inequity, access gaps, limited options being presented. Black women routinely face misdiagnosis, lack of resources, and health disparities that stem from generations of medical apartheid. Also, endometriosis affects about 10% of reproductive age women, yet economic toll in the US is staggering. Almost $12,000 in indirect costs and $15,700 indirect costs per patient every year. Despite this, our national data on prevalence and outcomes remains limited because studies often rely on self-selected surveys or inconsistent diagnostic standards. I know many of you are familiar with the work Congresswoman Williams and Underwood have been doing, leading the way and leading this charge. My goal today is not to walk through the bill line by line because you already know the policy. However, my goal is to share the human side, the patient side, the racial equity side, and the research gap side, the parts that make legislation like this necessary and not just nice to have. Now, I want to return to those 3 guiding points that I led with earlier, because these tie directly into the Endometriosis CARE Act. First, we have, as I mentioned, endometriosis is not a one-size-fits-all. It requires personalized and evidence-driven care. Second, endometriosis is impacted by health disparities, and these health disparities profoundly shape who gets diagnosed, who is believed, and who receives timely care. Black and brown women are disproportionately harmed. And lastly, although we've seen progress, which I've mentioned, we still have such a long way to go. And research is the best way we can get there. For communities like the ones I serve, and for women whose stories echo my own, this represents hope. It represents a future in which patients are believed, diagnosed properly and early, treated equitably, and supported through comprehensive research and policy. Endometriosis affects 1 in 10 with the uterus. Before too long, the condition has been overlooked, misunderstood, and underfunded. When you layer racial disparities on top of that, then inequities multiply tremendously. I sit here today not just as someone living with endometriosis, but as someone representing thousands of Black women whose pain was not believed, whose symptoms were dismissed, and whose treatment options were limited. If health inequity is the most inhumane form of injustice, then addressing racial disparities in endometriosis care is one step towards justice. So thank you for your time, your attention, and your commitment to understanding this issue. I welcome any questions you may have. And if you are interested in learning more about Endo Black, please follow us on Instagram at Endo_Black and visit us and learn more about our resources at endoblack.org. Thank you.
Thank you so much, Lauren, for sharing your lived experience. And that is a good reminder to share with attendees. Please drop any questions you may have for any of our speakers in the chat. We will have time to answer questions at the end of this session. Now, I'd like to pass the microphone to an Endo Foundation ambassador and host of EndoTV, longtime endometriosis advocate, Diana Falzone.
Thank you so much, and good morning to everyone. Thank you to Congresswoman Williams and to Lauren for sharing your stories. It's never easy. I'm honored to join you today on behalf of the Endometriosis Foundation of America, EndoFound, and grateful to the House Endometriosis Caucus for bringing national attention to a disease that affects nearly 1 in 10 women, girls, and people with a uterus, yet remains profoundly misunderstood and misdiagnosed and underdiagnosed. EndoFound works every day to change that. We lead national education initiatives in schools, fund innovative research through our EndoFound Research Grant Program, and the Seckin Endometriosis Research Center at Cold Spring Harbor Laboratory, host global scientific conferences, and provide resources for patients and families. But beyond the data, this is a deeply personal issue for millions of Americans, including myself. I'm Diana Falzone. I am a longtime ambassador for the Endometriosis Foundation of America, and I have endometriosis. I still remember the day I received my endometriosis diagnosis in 2016. At 32 years old, I learned I had endo, and I was told I was infertile. Endometriosis is one of the leading causes of infertility. Like many in the endometriosis community, I faced a long and arduous journey. 21 years filled with uncertainty, pain, and countless visits to doctors who never mentioned the word endometriosis. I was told some girls have tougher periods than others. I was given birth control and sent home. Endometriosis is a complex and often debilitating disease that impacts every facet of life. Endometriosis does not have a cure. As of now, excision surgery is considered to be one of the best methods for treating endometriosis. Even so, I've had multiple excision surgeries and lost several organs due to this insufferable disease over the last 9 years. It should not be this way for anyone. Endometriosis is often associated with bad menstrual cramps, but its impact is far beyond that. Extrapelvic endometriosis can cause lung collapse, bowel obstruction, kidney failure, bladder issues, and more. I have almost gone into kidney failure twice due to extensive endometrial fibrosis that was described to me as cement on those organs, which were compromising my kidney function. The first time was in 2019. 10 months after I gave birth to my son. Due to my endometriosis, I underwent IVF in order to conceive him. I had continual flank pain, bloating, and a persistent low-grade fever. I was tested for UTIs, which were negative, and told to try to get more sleep and self-care as a new mom. Finally, after months, I reached out to Dr. Tamar Seckin, endo excision specialist and co-founder of EndoFound, who said my symptoms were very concerning. I had an MRI that day and was in surgery within hours. I will never forget when a surgeon told me in the recovery room that I was 2 weeks away from losing a kidney, and she said no one wants to be on dialysis, especially as a new mom. I never imagined I would live through that harrowing experience again. However, in November 2024, I almost went into kidney failure for the second time. It took over a year of going to specialists like orthopedists and rheumatologists due to symptoms that I did not think could be endometriosis related. Each day I felt weaker. Each day was harder to get through as I managed a full-time job and caring for my young child. I kept pushing through until one day I fainted on my bedroom floor in front of my then 6-year-old son. I called my mom and told her, I think I'm dying and no one can help me. She said to call Dr. Seckin. It was then I called Dr. Seckin, and he said he thought my symptoms could be related to endometriosis. He was right. A year ago, during my surgery, we discovered that my endometriosis was severe, and my ureters were cemented from endometrial adhesions. My remaining ovary was tangled up in my ureters from endometrial fibrosis and could not be saved. 5 years prior, during another endometriosis surgery, my other ovary had to be removed due to recurrent endometriomas, also known as chocolate cyst, along with my fallopian tubes. Last November, at 41, I immediately went into surgical menopause, which has its own set of potential issues without proper hormonal replacement therapy, like higher risk of cardiac disease, dementia, bone loss, and more. Endometriosis has been my forever war. I sometimes wonder if I could have been saved from the severity of this illness if a doctor diagnosed me when I was a teenager. This is the first time I have shared my most recent endometriosis surgery. It's not easy. It's deeply private. I'm sharing this to help describe the insidious, destructive, and unrelenting nature of endometriosis. It took 21 years for me to get a diagnosis and the necessary treatments. Meanwhile, the financial cost of having this disease is well into the 6 figures for me, and I've had to fight my insurance company many times so they would cover at least some of the vital organ-saving surgeries. Imagine a woman who does not have health insurance, money, or access to care. What do they do? My story is just one example of what individuals with endometriosis deal with. There are thousands of stories just like mine. Women who have lost their kidneys, who have nearly died from bowel obstruction, who are living with colostomy bags, and who have been robbed of becoming mothers. My goal, as I know it is also yours, is to eradicate endometriosis. Together, we can break the stigma surrounding endometriosis and advocate for better education, awareness, and healthcare treatments. We must unite in our efforts to push for research funding, support healthcare policies that prioritize women's health, and advocate for healthcare professionals to equip themselves with better knowledge about endometriosis. Thank you for being here, for listening, and for your commitment to making a difference for millions of women and individuals born with a uterus with endometriosis. With that, it's my privilege to introduce someone whose voice and leadership has brought new visibility to this issue, Alexis Roderick-Joel.
Alexis, I'm sorry. I just wanted to make sure you know you're on mute.
Sorry. Thank you, Diana. Good morning. It's really an honor to be here and speak to everyone, especially in this setting. I've been speaking a lot about my journey, but never at this level. And hopefully this means that change is coming soon. This past July, I had my third surgery for endometriosis. My journey began a long time ago. Growing up, I had many symptoms. I never really pieced them together. I always had intense cramps, heavy periods, radiating pain down my legs during my period, made walking difficult. I had bowel symptoms. I had it during my period, and I also had urinary symptoms. I would be prescribed antibiotics, even though I rarely tested positive for urinary tract infections. I did go on to have 2 children, and after the birth of my second in 2017, my symptoms intensified. The pregnancy was tough. I had preterm contractions, IV iron infusions weekly, restless leg symptoms, and overall just a very difficult pregnancy. I made it to almost 38 weeks when her movement stopped and they induced me. Luckily, she was born healthy, but I am convinced that the difference between my first pregnancy and my second is solely attributed to my endometriosis worsening. I had a PCOS diagnosis, but I had a new gynecologist tell me that she didn't know who gave me that diagnosis because I didn't physically look like I had PCOS. I had a surgery to remove fibroids that when they went in to surgically remove them, they were no longer there. I had constant urinary symptoms. I had pain on my bladder, even to the touch. An ENT put me on meds for stomach issues. It felt like food was getting lodged in my throat, while simultaneously, he was telling me there was also nothing wrong with me. A urologist prescribed me medication for urine flow, even though my tests were all normal. I had visits to the following doctors: GYNs, ENTs, orthopedists, gastroenterologists, endocrinologists, rheumatologists, infectious disease doctors, urologists, and more CAT scans and MRIs than I can count. My pain was cyclical. It escalated over time, and I was begging doctors to help me. An abdominal MRI confirmed my intestinal tract was backed up. I was told to eat better, even though I'm a vegetarian and an avid equestrian. The rest of my testing was normal. I was able to obtain a diagnosis from a new concierge gynecologist. He told me it seemed that I may have endometriosis. He saw my uterus being pulled to the right side of my stomach. The way to confirm this diagnosis was to check laparoscopically. He did the surgery to confirm the disease and remove what he found through ablation. Though not ideal, I was unaware that excision was the gold standard for removal. By the time I agreed to confirm this diagnosis, I had gained 15 pounds in 3 months due to inflammation. I had a distended stomach to the point I was in constant pain. I was exhausted, lethargic, and unable to stand for long periods of time. I was unable to eat normally due to my digestive symptoms. I had bladder pain to the touch and the feeling that I was being stabbed through my stomach straight through to my lower back. In January 2023, he did an ablation surgery. After this procedure, I had internal bleeding. I was admitted back to the hospital. I never recovered fully due to not excising the disease and scar tissue that made my already intense pain constant and debilitating. I have 2 young girls and we were traveling around the world. I did not have the time or ability to care for myself. The one thing that health, or lack thereof, does is put your life in perspective. After months of not receiving answers, I got on a plane to New York City. I was just going to check into an ER. I knew that if I had a chance of someone helping me, it could possibly be there. I was reaching out to anyone I knew to get me in touch with the top doctors. The head of GYN at one of the best New York City health systems told me I do not have endometriosis, and this pain is not gynecological. I was dismissed again. The head of endometriosis at a large center in New York City saw me, did an exam, told me my pain was coming from my bladder, and this was not endometriosis. At this point, I had already confirmed I had endo. She said I should see a urologist. I also had all of that testing, and it was all normal. I returned to Florida confused, in pain, and no farther along than when I left. I knew my bladder pain was real, but the other symptoms I had would move and shift and change, and they would come and go. The pain would bring me to my knees crying, and then I would have a few good days. It's at this point that you start to go crazy. You believe that you may have some crazy illness that no one will figure out, and you start to resign yourself to the reality of living in this pain. I woke one night in pain and started Googling endometriosis specialists in New York City. I kept seeing the name Dr. Seckin. He had already operated on comedian Amy Schumer. We had friends in common, and I was able to get in touch with her. She told me that he will change my life, and she was correct, but in more ways than I ever could have anticipated. I set up a Zoom call and told him I needed help. The first thing he did was tell me everything that I went through and felt really did sound like endo. After years of having my pain diminished and dismissed, just hearing that was such a relief. The mental toll that this disease takes sneaks up on you. You are in fight or flight mode, and once you feel like you can process your emotions, it is overwhelming. I had not bothered to dwell on what my life may look like or how bad it would be if I did not find answers. But when you have someone confirm that you are not crazy, there can be a light at the end of the tunnel. It all really brings it to the surface. Keep in mind, you still doubt that what you have is real. I didn't think what I had, even through all my pain, would qualify for his type of surgery based on the complex, debilitating cases that he handled. I went to New York City to see him, knowing I would probably end up staying and possibly have surgery. You don't even know what the surgery is going to entail, but it's the best chance you have. He will go organ by organ through your entire abdominal cavity, excising the suspicious lesions and keeping your organs intact, hopefully. For my situation, I wanted to keep my hormonal function due to the risks and complications that come with giving up your ovaries, like needing replacement hormone therapy or not being able to have hormone replacement therapy. For many younger than I, this would mean removing their reproductive system. By the time I finished my surgery, I had 27 specimens removed. My appendix was taken out due to endometriosis. I had a uterine fibroid that was so large he had to cut open my uterus and stitch it back together in order to remove it. I had my ovaries suspended by string coming out of my stomach, which after surgery leaves you unable to move for 24 hours. The first question we all ask when we wake is, was it endo? Did you see it? We're all so traumatized by years of being gaslit to think that there is nothing wrong and left to figure out what to do. Most doctors have the not me approach. You're just saying to someone to please own it and help you. It is such a dark and lonely disease. That all changed after I met Dr. Seckin. I was no longer scared of it. It was real. I saw the video of my surgery and I felt like I had an answer. I could fight it. Sadly, our stories do all sound the same. Unfortunately, not everyone finds a doctor like him. Many women have surgeries that do not help them. They're given hysterectomies, too young, or told nothing is wrong, revealing the larger issue. A system that is not designed to recognize, diagnose, or properly treat this disease. Finding a doctor that is willing to take the time to do this surgery the right way is like finding a needle in a haystack. We are unqualified to self-diagnose, research our surgical options, and not because of lack of trying, but due to the lack of information and research. The lack of information starts in grade school. If I knew the name of this disease and how these symptoms can present, I may have been able to find the right doctor sooner. When you think of cancer, you know the top institutions. They pop right into mind. When you think of a cardiac surgeon, you have a clear way to narrow down your search. When it comes to women's health, in particular endometriosis, it is a Herculean effort to gather information, make informed decisions. We weed through websites and Reddit to inform ourselves. Many gynecologists will do this surgery without having the education and knowledge to be qualified. As with other specialties, it seems like the Wild West. This is in the United States of America in the year 2025. We value women, education, reproductive health, and the credentials of surgeons in this country. This disease is treated as if it is an anomaly. I had my third surgery this past July. In order to not have a full hysterectomy, I had another resection of my uterus due to a large adenomyoma. I had removed my fallopian tubes, an ovarian cyst that turned out to be endometriosis. I was able to also remove scar tissue on my lateral sacral ligament that had been causing years of throbbing pain. Most doctors and insurance companies would not have taken the time to save my ovaries and my uterus. I'm so grateful I was able to preserve my body the way I chose, but I have access and the financial ability to make this choice. Most do not. This is where I have to use my platform to pay it forward. I feel eternally grateful for how I feel today. I want to help you reach your goal for education, research, and awareness. We are working at EndoFound to further these causes, but we know there is a bigger picture and we are a piece of this puzzle. We must do this with and through the federal and state government. We know this disease affects 10% of women of reproductive age. We have to research the hereditary components, educate young students about the symptoms, train doctors and surgeons to excise this disease, and have the insurance company cover the right type of surgery. I have used my platform to bring attention to this cause, not because I think my story needs to be told. We all have them, many worse than mine, but because the amount of women that suffer needlessly is a massive failure of this system. There is no other known disease that affects such a large amount of the population, more so if they are predisposed. Yet, for too long, it has remained underdiagnosed, misunderstood, and underfunded. Its symptoms are often dismissed, its impact is underestimated, and most crucially, its biological roots are not fully understood. My girls will most likely suffer from this disease, but I will know what to look for, and I will make sure they are educated. I am hopeful for what we can accomplish at this moment. We have a voice and a seat at the table, and now it is with us to get it done. I'm happy to introduce Dr. Charlotte Frank Sage, who was recently hired as the EndoFound's Director of Research Initiatives. She was formerly VP of Scientific Programming Management at Cellmatics Therapeutics. She's passionate about women's health and instrumental in helping us reach the next level. Charlotte is leading EndoFound scientific programs that advance discovery and foster collaborative progress in endometriosis research. She oversees the execution of high-priority research initiatives, including the partnership with Cold Spring Harbor Laboratory and EndoFound's research grant program. We are so grateful to have her working at the Endometriosis Foundation.
Wonderful. Thank you so much, Alexis, and good morning to everyone. Thank you all for the opportunity to share some of EndoFound's research and scientific programs and to advocate for the importance of ongoing support for clinical researchers and the training and support of future clinicians and scientists. EndoFound is committed to advancing groundbreaking research, strengthening scientific infrastructure, and supporting innovations that move the field closer to early diagnosis, effective treatment, and improved quality of life for millions. Since 2009, EndoFound's early leadership has steadily built national awareness and momentum around menstruation and endometriosis. As more people began seeking answers, we expanded our impact by funding research directly beginning in 2017. This step helped catalyze additional scientific interest and new research initiatives across the country. EndoFound has built one of the nation's strongest pipelines of endometriosis research by funding leading institutions, including MIT, Stanford, Cold Spring Harbor Laboratory, Mayo Clinic, and Johns Hopkins, to investigate the disease's origins, biology, genetics, environmental risk factors, and psychological burdens. To cultivate the next generation of endometriosis experts experts, we also provide key support to less established and early stage investigators, including those at institutions that might not be otherwise to access funds to do work in the space. We funded research across 15 United States, spanning the South, Midwest, Northeast, West Coast, and Southwest, reflecting a broad and geographically diverse national footprint. Our investments are driving progress in early non-invasive diagnostics, advancing new therapeutic approaches, including non-hormonal treatments and immune-based innovations. And by supporting both senior scientists and the next generation of research, EndoFound is accelerating scientific discovery and expanding the research ecosystem required to finally deliver better answers and better care for millions of Americans. This spring, we launched our most ambitious initiative to date, the Seckin Endometriosis Research Center at Cold Spring Harbor Laboratory in Long Island. This partnership established the first dedicated endometriosis research center within a premier U.S. basic science institution. The center is generating the foundational insights the field has lacked for decades, clarifying the origins of endometriosis and defining its molecular subtypes. And through this partnership, we are expanding a biobank and data program designed to fuel translational research for years to come. And this progress is only possible through strong partnerships. Our greatest successes come when we collaborate. 1 in 10 women have this disease and millions remain undiagnosed. And investing in the science needed to understand, to diagnose, and ultimately cure endometriosis is a national priority. Continued congressional support is essential to accelerate the discovery, expand research funding, and ensure that scientific advances reach the patients. As I mentioned earlier, collaboration is key, and I'm honored to work alongside extraordinary partners, including the principal investigator at the Seckin Endometriosis Research Center at Cold Spring Harbor. We hope that this center is the first of several centers of excellence, each advancing discrete but interconnected goals, such as developing and standardizing translational models, creating non-invasive diagnostics, pursuing disease-modifying non-hormonal therapies, and enabling clinical trials. Together, these efforts form a comprehensive roadmap toward earlier diagnosis and accessible and effective treatments for all individuals affected by endometriosis. So it's my pleasure to introduce Dr. Semir Beyaz, who is leading the first crucial step of this pathway. Thank you. There he is.
Thank you, Charlotte, and thank you to the caucus for prioritizing women's health research, and in particular for endometriosis, which, as we heard, real stories from Diana and Alexis and Lauren, how debilitating this condition is. And so I'm a molecular biologist, I'm a cellular biologist, so I look at the molecules and cells and genes. And I was fortunate to meet Dr. Seckin, who is, like, as you heard, the leading surgeon in the space, working for many decades, providing a solution to an overlooked and dismissed problem. And I am very much inspired by the stories and the journeys that are shared in that space. And I'm dedicating my career to one day end Endo. And how can we do that? So Cold Spring Harbor Laboratory is a basic science institution. We try to understand the causes and consequences of diseases like endometriosis. We look at the genes, we look at metabolites, we look at your immune system, we look at stem cells. And so collectively, these studies can provide an explanation. How does endometriosis start, right? Like, I'm sure, like, in those stories you heard today, all of you were thinking, like, how this disease starts? Like, how does a cell from a uterine lining migrates to the ovary or to the colon or to the lung or to the other parts of the body's cavity? We don't know, and we need to understand, how does this start? How does this progress? How does it form a scar tissue? And then from there, we are going to figure out how we can heal that scar tissue, how we can prevent that scar tissue from happening. And the most importantly, surgery should not be the only way we can diagnose this disease. And my goal is to put Dr. Seckin for a good retirement. Once he retires, no woman should find him, should Google the best surgeons. I think we can do better. And so for cancer, for example, we now know that we can diagnose cancer non-invasively. We can diagnose cancer very rapidly with high accuracy. Endometriosis is, not cancer, but it is as worse as cancer. So I started my career as a cancer researcher. This country built the infrastructure that is making cancer a manageable disease. And so we need to get the congressional support to make endometriosis a manageable disease. And my hope is to eradicate it. We don't deserve this disease. Our mothers, our sisters, our friends don't deserve to go through that pain, to go through that neglect. And I'm committing as the lead of this new initiative here, my career to understand that. And so in summary, as I mentioned to you, this is a collective effort. Endometriosis affects the whole body. It is not a disease of one single organ. You heard at least 5 organs that endometriosis affects in the personal stories. To study the whole body and to study endometriosis as a whole, we need the support of the whole community. The entire country needs to hear those stories and say that, okay, here are the resources that we deploy to recognize this disease as complex, as chronic it is, and provide some dedicated investment. Without that, we cannot solve this. I'm just going to tell you the truth. We need to come together as a nation, as a country, as a society, to speak out loud, not to ignore this, and put the required dedicated investment for research, for advocacy, for people who are in need of care to get it. And in summary, I just want to thank you for supporting this critical scientific work. I would love to, expand these efforts to other institutions, but the Endometriosis Foundation of America especially, thanks for the vision. We are going to take that vision now further into molecules and cells and help us bring forward a future where patients receive answers sooner and better care throughout their lives. So I'll turn it back to Diana to close with EndoFund's policy recommendations. Thank you. I'll also be happy to answer any questions that you may have.
Thank you, Dr. Beyaz, and thank you for your groundbreaking work. In closing, the Endometriosis CARE Act is a critical step toward the future patients deserve, and it closely aligns with EndoFound's mission across all 4 of our pillars. It strengthens our research pillar by investing $50 million per year in NIH research to advance discovery, improve treatments, and create the first centralized clearinghouse of evidence-based information. It advances our awareness pillar by identifying and reducing the barriers patients face, whether it's insurance gaps, provider shortages, or other obstacles that prevent timely care. It supports our education pillar through a national public education campaign that includes culturally competent mental health resources and targeted outreach to underserved communities. Work we are already advancing through our National Empower program, our College Ambassador Network, and our education initiatives for school nurses and coaches. It reinforces our training of medical professionals by improving provider education, helping close the long-standing diagnostic and treatment gaps that have harmed patients for generations, and it deepens our commitment to equitable care by commissioning the first National Academy study on endometriosis disparities, providing Congress and the field with the data needed to drive meaningful, lasting change. These steps will change lives, and they are achievable with congressional leadership. Thank you to the caucus, to Endo Black for your partnership, and to all the members and staff joining today. EndoFound looks forward to continued collaboration to ensure that every patient receives timely diagnosis, effective treatment, and compassionate care.
Thank you so much, Diana, and thank you very warmly from the Endometriosis Caucus and from Congresswoman Williams for all of our speakers taking the time to share their lived experience and expertise with congressional staff today. Thank you to the congressional staff who have taken time out of their busy schedules to learn more about endometriosis and the policy recommendations from these important leading groups in the space. Before we wrap for the day, I'd like to give one more plug for the Endometriosis CARE Act, a step towards appropriate congressional investment in endometriosis research and care. We are inspired by and taking the lead of the Endometriosis Foundation, Endo Black, and other organizations that are leading work to research and provide the care that patients need. And we are hopeful that Congress and the federal government will step up and do our part in supporting the very necessary research and care that I know that endometriosis patients are desperate for. Before closing for today, I'd like to open the floor for any questions or comments from participants, please feel free to drop them in the chat. In the meantime, I have a couple of questions to throw to the group. First, would you be able to tell us a little bit about the status quo of congressional or federal investment in endometriosis research? And would you be able to share a little bit about what organizations like Endometriosis Foundation are doing to fill that gap in federal support?
So there is, there is some investment. There is a National Institute of Health institute that supports endometriosis as a large umbrella of many diseases that women and children are suffering from in our nation. But it's not enough, right? So like for a disease that affects 1 in 10 women and that debilitating, we need like a moonshot project. Like we had the cancer moonshot project. We need an endometriosis moonshot project because it's unacceptable to live with that pain, to live with that suffering. I'll just end there, like we need, like probably this act will be a good first step in that direction, but we can do better.
Absolutely. Thank you so much for sharing that context. Speaking of doing better, the Congresswoman, the Endometriosis Caucus know that investment is just the first step towards research, treatment, ultimately a cure, all of that important work. The Endometriosis Caucus will be meeting regularly to explore policy possibilities, policy options for continuing the fight against endometriosis. I would like to extend an open invitation to the speakers here today, your organizations and other advocates in the space to dialogue with the caucus and to continue to join us to work through possible solutions and policy actions in the future. Finally, thank you to our congressional colleagues on the phone today for your support for the Endometriosis CARE Act. That's being introduced today and is just the first step in addressing endometriosis on the congressional level. Please stay tuned for future Endometriosis Caucus events and make sure that your boss is signed up to be a member and receive all of those updates. I'm going to put my contact information in the chat so that anybody can reach out to me if you have any questions or if you would like to get involved with the caucus. Thank you again for taking the time to speak with us today, and I hope everybody has a good day.
Wonderful. Thank you very much.
Thank you so much.
Bye-bye.